I'll be speaking on the basic life support. So, whenever there's a collapse in front of you, how to resuscitate the patient, we are going to talk about that. So, the guidelines are laid by the American Heart Association and they are revised in 2020. And according to the new guidelines, the steps of the management are changed from ABC to CAB. So that is compression is the most important thing in the resuscitation. So C stands for compression, A is for airway, and B is for breathing. Now, as you can see in this slide, that once there is arrest or the patient falls unconscious or the patient collapses, after that the organ deterioration starts within 6 to 8 minutes. So we have to be very, very prompt and we should know the steps by heart and we should be very, very familiar with these steps so that without wasting much time we can start the resuscitation. So let's run through these steps now. So whether it is in hospital or outside hospital arrest, the steps remain the same. Only difference is if you are in the hospital, you will get the help very fast, but the steps remain the same. So the first step is whenever there's a collapse. Supposing you are outside and there's a fire or somebody is drowned or you are in a hospital and the patient has collapsed in the washroom. So are you going to start resuscitation in that scene or you're going to shift the patient to a safer scene? So that's the first important thing. So whenever there's collapse or there is arrest, make sure that the scene is safe to resuscitate the patient. So if the patient is in fire or there is he's drowned, then you get the patient out of that scenario to a safer place. So scene safety is the first and the foremost important step. So get the patient out from that scenario, place him in a safer place, and then start with the steps of resuscitation. So first is to recognize the arrest. So how do we recognize a patient which is not responding? So the best way is to tap on the shoulder. You have to be loud enough and audible. Supposing if the patient's hearing is slightly on the lower side, then you have to be very, very audible. So tap loud on the shoulder. Sir, are you okay? Are you okay? So like that, you tap on the shoulders, not anywhere else, not on the face, not on the neck, because we want to avoid the movement of the neck if there is suspected cervical spine injury. So that is why tap on the shoulder. Sir, are you all right? Are you all right? And if the patient doesn't respond, then immediately call for the emergency response system. So call for the help, and if you are in the hospital, press code blue, or you can dial from the extension or from your mobile. When you are talking on the phone, tell them your location, the building number, the bed number, who you are. Identify yourself that I am Dr. So and so speaking from this building and this floor, and the bed number is this. And let the person who's talking to you on the phone, let that person again respond and repeat the same thing before you hang up the phone. So you inform them your location, your bed number, identify yourself, let them respond, and then hang up the phone. Ask them to get the crash cart and the AED as soon as possible. Now, once you have recognized the unresponsiveness by tapping on the shoulder, which is step 1, step 2, and you have activated the emergency response system, after that, you palpate for the pulse and simultaneously check for the breathing. So which pulse will you palpate for? So palpate, put your fingers in the center, put your fingers on the trachea and slide them slightly to the lateral side and palpate for the carotid. So you can do the carotid palpation either with 2 fingers or 3 fingers. Go from the center to the side, and the side which is there at the groove beside the trachea, in the groove between the sternocleidomastoid and trachea, palpate for the carotid pulse. Now simultaneously also check for the breathing. So if there is no breathing, there is no chest rise, the abdomen is not moving, and there is no pulse, then immediately start with the compressions. So this is how you check for the pulse beside the trachea with 2 fingers or 3 fingers, and then you start with a compression. So compression, how do you give the compression? So the compressions are given on the lower part of the sternum. You give it with the heel of the hand. So with the heel of the hand, you place the heel of one hand on the lower part of the sternum, then put the other hand over it, interlock the fingers, and start with the compressions. So compressions have to be 100 to 120 per minute. Push hard, push fast, allow for the adequate chest recoil so that there is adequate venous return, and switch the roles only after completing 5 cycles and avoid the interruptions in the CPR. So this is how you are supposed to give the compression. Lower part of the sternum and 100 to 120 per minute. Why we are giving 100 to 120 per minute? So that if the normal heart rate is between 60 to 80, and if we give compressions at about 100 to 120, then at least 80 compressions will be effective and it will generate the cardiac output. Now the idea behind the compression is that the sternum is compressed so that it compresses on the heart, and because the heart is stopped, now it will generate the cardiac output with your compression. So that is the idea behind the compression. So as I told you that it has to be on the lower part of the sternum. Now when you are giving the compression, all the 3 joints, that is the shoulder, the elbow, and the wrist, all have to be in one line, and you have to cross over, and with your weight should be falling on the patient, and all the 3 joints have to be in one line. The ventilation compression ratio should be 30:2. So give 30 compressions and 2 ventilation. Give 1 ventilation every 5 to 6 minutes. Now when you start ventilating the patient, that time certain airway maneuvers have to be done so that the tongue doesn't obstruct the airway and the ventilation is effective. Otherwise, if the tongue is obstructing, even though you're giving ventilation, it will not be effective. So there are 3 airway maneuvers, that is head tilt, chin lift, and jaw thrust. If you are suspecting a cervical spine injury, then do not tilt the head. That time give only jaw thrust. So head tilt, chin lift. Here it is shown, the head is tilted and the chin is lifted. So this you are not supposed to do when you are suspecting a cervical spine injury. So head tilt, chin lift, and there is no need to sweep the finger from the mouth. Okay. Then jaw thrust. Jaw thrust is given, the angle of the jaw is lifted this way upwards so that there is no cervical movement and you can give the ventilation easily. Now if you are a single rescuer, then you give the ventilation from the side of the patient, from the same side. If you are giving the compression, then just from the same side you give the ventilation with a pocket mask, or you can give mouth to mouth breathing. But if there are 2 rescuers, now you've already called for the help. Now if the second rescuer has arrived there, then maybe that person can stand on the head end and give the ventilation. In that case, you can give the ventilation with ambu bag. But if you are single rescuer, give the compression. After 30 compression, you give the 2 ventilation from the same side without going to the head end of the patient with a pocket mask, or you can give mouth to mouth breathing. The ambu bag is to be used in case of 2 rescuers. So 30:2, push hard, push fast, allow for the adequate chest recoil, avoid interruptions, and complete 5 such cycles of 30:2. 5 such cycles will be over in 2 minutes, and then after 2 minutes switch the roles. So that is how the compression and the ventilation is done. Now you have called for the emergency response system. Now if you have the rescuer who has come with the AED crash cart, then you have to attach either the AED or use the defibrillator in the hospital scenario. If you are if you are in the airport or somewhere, a mall or somewhere where the AED is available, then attach the pads. So what are the 4 steps for starting the AED? One is turn it on. Some of the AEDs, when you open the lid, that time it turns on. But otherwise, there is a switch over there. There's a button which you to turn the AED on. So turn it on and apply the pads. So the pads have to be applied on the right side and the left side. Right side below the clavicle, left side on the lateral side of the nipple, and attach the pads. You can also put the pads anterior-posteriorly. If it's a child or even in an adult, you can put it anterior-posteriorly. Now, once you have attached the pad, then the monitor will analyze the rhythm. So when it is analyzing the rhythm, that time you stop giving the compression. That is the only time that you stop giving compression. Otherwise, you continue the compression even when the pads are being applied. So the second rescuer who has come in with the AED will put the pad, will turn the AED on, put the pad, till then you keep giving compression. When the AED is analyzing the rhythm, that time you stand away. If it's a shockable rhythm, then give the shock. And the machine will prompt you. It is automatic prompt generated, so it will prompt you, shocking the rhythm. So when it is shocking the rhythm, when it is shocking, that time you say, I stay clear, you stay clear, all clear. So make sure that everybody is away from the patient and nobody gets electrocuted. So that is the most important thing. Make sure that everybody is away and then give the shock. Once the shock is delivered, after that, switch the roles. So when the rhythm is being analyzed, you switch the roles, because after giving compressions for 2 minutes, the person who's giving the compression will get tired. So that time when the AED is analyzing the rhythm, switch the roles, go to the head end. The head end person will come to the chest for giving chest compression. Switch the roles and start with the CPR without wasting much time. So these are the steps for, yeah. So this is in the hospital. So if you have this defibrillator, then again turn it on and charge it, and then place the pads on the patient in the same place below the clavicle and lateral to the nipple. And then when you are delivering the shock, I clear, you clear, everybody clear, and just make sure nobody is near the patient and give the shock, and then start with the compression. So the quality of the CPR has to be very, very effective. As we discussed earlier, 30:2, give 5 cycles of give 5 cycles of 30:2. The compression has to be high quality compression. So push hard, push fast, 100 to 120 per minute, and it should be 5 centimeters or 4 centimeters in adults. Okay, in 5 centimeter in adults and 4 centimeter in infant. So 5 centimeters or 2.5 inches, 2 to 2.5 inches. For child, it is for infant, it is 4 centimeters or 1.5 inches. So that much should be the compression and allow for the adequate chest recoil. Yeah, all these steps we have discussed. Now, in case of pregnant patient, the uterus presses on the inferior vena cava and it will hamper the venous return. So, in case of pregnant patient, push the uterus to left side. So, or you can give 30 degrees tilt and push the uterus to left side, and the steps of the CPR remain the same. Once you have achieved the return of circulation, or there is some rhythm which is normal rhythm, normal sinus rhythm is returned, then you place the patient in the recovery position, which is the left lateral. So in case if the patient vomits or something, he will not aspirate. So that is the logic behind putting the patient in the lateral position. Now, pediatric BLS. So, any child less than 1 year is called an infant, and child from 1 year to puberty is called a child, and above puberty is an adult. So the steps of the CPR by and large remain the same. Only thing is in infant, instead of when you are giving resuscitation to the adult, you tap on the shoulder to confirm the arrest. Whereas in child or an infant, you tap on the foot because that is the most sensitive part. So the differences in the adult and the infant CPR are, one is in the infant you tap on the sole of the foot and not on the shoulder. Then second is palpation of the pulse. So we in infant we do not palpate for the carotid pulse, but we palpate for the brachial pulse in the mid arm. Okay, because that is easily accessible, and sometimes if the patient is chubby, the child is chubby, you may not be able to palpate the carotid pulse very easily. So you palpate for the brachial. Then again, the steps of the CPR remain the same. Only difference in children is if you have just witnessed the collapse in front of you, then you still have the time to go and call for the help. So if you have just witnessed the arrest, go and call for the help. But if the arrest has occurred earlier and now you are seeing the patient, then you start with the CPR, give CPR for 2 minutes and then go and call for the help. Okay. Now, if you are two rescuers, in children most of the time arrest occurs because of the hypoxia. So that is why you give 15:2. So 15 compression and 2 ventilation if you are two rescuers, and if you are a single rescuer, then 30:2, same like an adult. Now, in case of infant, if you are giving compression, then you can give the compression with 2 fingers placed at the center of the chest, or you can encircle your hand around the chest and give the compression. But that is in case of infant. A bigger child, you will not be able to encircle the hands around the chest. So that is why again you either give the compression with 2 fingers, or little older child, you can give the compression as shown in the picture with one hand. Yeah. So this is the difference that I told you. If you are two rescuers, then 15:2. Then in case of choking, so whenever there's choking, Heimlich maneuver is practiced, and you can go behind the patient and give upward thrust so that the foreign body comes out. If it's an obese or pregnant patient, then you just have to give chest thrust. If it's an infant, you can place the infant prone and then give the thrust at the back. And these are the steps of CPR. So I hope now if you have an arrest or the patient becomes unresponsive in front of you, you know the steps and how to go about it. Thank you very much.